Now on with the Medical Explorer. The infant mortality rate is defined as the number of newborns that die each year in our society. As medical and health care advances, the infant mortality rate decreases as more babies live to become adults. Children in the United States have very few deaths during the first few days of life because of the extremely high quality of medical care given in the hospital at the time of delivery. For our community, the Fremont Medical Center serves as the major newborn nursery and newborn intensive care facility. We're at the Fremont Medical Center delivery suite today. With me is Bonnie Sands, head nurse of the nursery. Bonnie, show us a little bit about where we're standing here. What are we looking at right back here?
Okay, we're looking into one of the delivery rooms. They're setting up a sterile table in preparation for delivery.
So this is the exact place where babies are born. This is where it happens.
This is it. That's right.
Cesarean sections and everything would take place right here.
No, cesarean sections are done in surgery, which is down the hall.
Okay, so
we only do regular vaginal deliveries here.
Great. Well, let's head over. Imagine a baby being born, and let's just walk over to the nursery and see where we're going. We're just going through a hallway here, and right across the hall we'll enter the nursery area. Is that correct?
Right.
So we can just imagine a baby being brought through here on the little
all the relatives
bassinet.
out here watching, wanting to see the baby.
So here we go, coming into the nursery area. And
Right.
This is all your office area.
This is our office area where our secretary does all the charting, where we chart, the
Let's
doctors
take a look
chart.
over here. See, she's got a certificate of birth, getting ready for someone.
Right, we just had delivery and she's doing the charting. We do give them a complimentary birth certificate with the footprints on it, and if they want their own birth certificate from the state, then they get that from the health department.
I see. Now, what's this room behind us over here?
Okay, this is one of our nurseries. It's empty right now. We also use it for storage of our empty cribs. When we're full, we'll have about 8 to 10 babies on this side, or less.
Now, it's about 12:15 right now, lunchtime. Where are the babies right now?
Right now, they're out with their mothers. We have a modified rooming in where they spend most of the day with the mothers.
I see.
So our nursery is empty at this time.
Okay. Well, we can hear some babies crying back there. Why don't we head back into the intensive care nursery?
Okay.
So there's a doctor back here examining one of the newborns. Tell us what's going on.
This is one of the babies that was just born. He's doing an admit examination on the baby, checking everything out, make sure everything's fine.
Who is this doctor we have here?
This is Dr. John Rose.
And where's he from?
He's from Brownsville.
Came all the way down from the foothills for this.
Right. This is one of twins. This is the little boy.
We're talking now with Dr. Rose, one of the family practitioners from Brownsville. Is that it?
That's right. Yuba Health Center, Brownsville.
I see. And you delivered twins today.
Well, actually, I was assisting Dr. Hilger in the delivery and then following the infants here in the nursery.
I see. And what, is this a boy or a girl? I can't even tell right now.
This one's a young lady, and her little brother is over next door.
I see.
The McAllisters are very proud parents today of 2 new children and have a lot of work in store for them right now.
Now, these are fraternal twins, is that right? Not identical twins.
That's correct.
Could you tell us the difference?
The identical twins come from the same fertilized egg and then split in its development, so they have identical DNA. This type of twins comes from 2 separate eggs and consequently have different DNA. Consequently, they're absolutely different people.
Well, we've entered the intensive care nursery, which is a major part of the Fremont Medical Center nursery. I've always wondered what exactly is meant by intensive care nursery versus a regular nursery. Can you tell us?
Intensive care nursery is just a place where we can observe the baby on a much closer basis. We have the equipment, the monitors that we can place on the baby, and we can just observe the baby much closer than we can in the normal newborn nursery.
Okay, let's look at this baby over here. What's going on? We see this big shield over the baby's head.
This baby here has oxygen. We deliver it through what we call a head hood, which is this device over the baby's head. This way we can leave the baby just dressed in a diaper and we can see him total, and he's just getting oxygen over his head. He also has the heart rate and respiratory monitor on him so we can monitor his vital signs. And this little gold patch on his tummy is a temperature probe. We can also regulate his temperature so he doesn't get too hot or too cold. And it's just a very good way of observing a baby without
So-
having to have them covered up.
Right, they don't have to have a tight mask over their face.
Right, and they can move their head from side to side in the head hood.
They actually don't even feel anything. They're just lying
No,
there having a good
right,
time.
just breathing in the
Right.
oxygen.
What is this hood up here? What is going on?
Okay, this is the radiant warmer. This is a heat source, which is regulated by this little temp probe, which is on the baby's tummy. We set it at we preset it to whatever temperature we want the babies to be, and then through that little box underneath the head, the radiant warmer, that regulates the heat, whether it's too hot or too cold.
So babies, when they're born, have trouble keeping enough heat in their bodies?
Sometimes they do, yes, and this way, this will increase his temp to a normal temperature, and
So you don't have to keep a thermometer in the baby?
right, we just check their thermometer once they come in, put them under here, and then check it again in a couple hours.
Great. Well, let's move on over to this big, noisy piece of equipment over here. We can hear it clicking right now. What's that clicking sound?
That's the baby's heart rate. Each beep you hear is the baby's heart rate, and as you can tell, it's much faster than your heart rate or my heart rate, and that is normal for a newborn. So besides seeing the pattern on the screen of the heart rate, we can also hear the actual beep beep of the heart. And this makes it easier too to keep an eye on the baby.
You can also set alarms here. I guess if the heart rate goes below a certain point, an alarm can go off.
We usually set the alarms so the heart rate, it will alarm if the heart rate goes below 80.
Yes.
This is what we call an isolette. This is we use for our premature babies who cannot maintain their temperature in a regular open crib, and we don't want to tie up a radiant warmer for them. We can put them in the isolette, and this maintains their temperature, and while they grow, they stay nice and warm. Once they reach a certain weight, we can put them into a regular open crib, and they usually maintain their temperature just fine. But for the first couple of weeks, usually they'll be staying in an isolette.
Now, I've heard a lot about this machine over here that lets us measure the oxygen in a baby's blood without using a needle. And this is, what is the exact name of this piece of equipment?
This is called a transcutaneous PO2 monitor.
PO2 meaning the amount of oxygen in the baby's blood.
Right.
Why don't we try it on my hand? Let's just put this on here. And
Okay.
I don't mind trying this today because we don't have to use a needle, and most of us don't like to have needles in our skin. This apparently is able to measure oxygen in the blood without sticking a needle through the skin. Bonnie is putting a conducting chemical on there so that I guess the measurement is easier to conduct through the electrical system. No pain. And now we find out that I'm dead. Is that right?
No, not quite.
Yeah, okay.
It takes a few minutes for it to calibrate within the machine, and we should get a reading.
So we see numbers there. It says TCPO2, meaning the amount of oxygen in the blood, and it's measured in pressure, millimeters of mercury. It says about 118. Is that getting close to what it really is?
Probably so. It needs to drop down a little bit farther, then it will start coming back up to what your actual PO2 content of your blood is.
So if I was breathing oxygen now through a mask, that number would go up likely. Is that
It would probably go up quite high.
great? So this is really nice for babies to not have to stick them with a needle every time you want to check their oxygen.
Right, it's very good because once you have a sick baby, you're sticking them anyway for other blood tests and not having to stick them for checking concentration of oxygen. It really saves on their little heels because we do heel sticks usually on a newborn baby.
This was certainly an excellent demonstration today, Bonnie.
you.
Thank you very much. I understand that Fremont is one of the most used, busiest nurseries around. How many deliveries do you do here a year?
About 1,700. I think last year was 1,780.
That really compares to hospitals in major cities. It really
Yes, it does.
Well, we're going to let you get back to work, and we'll head on back to the studio.
Okay.